Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Now coming into the causes and the risk factors. So what are the main causes for the formation of fibroids are gene changes, hormones, ECM that is extracellular matrix and growth factors. Here we are going to discuss about hormonal problems only because they constitute the majority of the fibroid problem. Coming to the hormonal disruption. Remember that females have different hormones like estrogen, they have progesterone, they have prolactin, they have FSH, which is follicular stimulating hormone, as well as they has luteinizing hormone, that is LH. So any disruption in these hormonal balance can lead to certain diseases. Okay, so today we are going to discuss about the disruption between the estrogen and the progesterone level. The estrogen and the progesterone level should be in a certain ratio. If this is the ratio, if this is estrogen and this is progesterone, if the estrogen is normal and the progesterone has gone low because of certain conditions, or the progesterone is normal and the estrogen has gone high because of certain conditions, that can lead into estrogen dominance, leading into fibroids. So what are the causes of this estrogen dominance? First, in the low progesterone level. If you are someone who is in your 40s or in your late 40s, then you are in the perimenopausal stage, which can be because of low progesterone level. So low progesterone level is one of the characteristic feature of perimenopausal stage. So that is physiological in nature. That can also lead into estrogen dominance, leading into prolonged periods. And then stress. So how is stress related to estrogen dominance or this hormonal disruption, as we are talking it so frequently, that stress is the main cause? Let me explain to you in very simple language. See, stress causes an increase in cortisol. Okay, cortisol, everybody knows about cortisol these days. It's all over the internet, it's all over Instagram. So you know that there is an increase in cortisol. It causes insulin resistance, a stage which is pre-diabetic in nature. And this insulin resistance can cause a decrease in progesterone or an increase in estrogen. So this cortisol hormone is causing increase in estrogen. Gut dysbiosis, this is something which is like least understood, but it has a lot of effect. See, your gut has certain bacteria and the gut metabolizes this estrogen. If there is certain problem in the gut, it can be because of a lot of antibiotic usage, you are destroying your good gut bacteria, or it can be because you are using a lot of proton pump inhibitors like pantoprazole, esomeprazole, rabdiprazole, and then you're destroying the lining or you're destroying the absorption capability. This all can lead into gut dysbiosis, where the normal good bacteria is not there. So there is malfunction in metabolizing this estrogen, which can lead into estrogen excess. Next, coming into the excess body fat. See, how does excess body fat cause excess estrogen, thereby causing fibroids or PCOS or anything else? Remember that excess body fat is the main reason for estrogen predominance, especially in teenagers or in people who are unmarried or in their early 30s or in their late 20s. Why? If you're having a stressful life and if you're eating too much, the cortisol hormone will tend to make your body fatter by depositing the fat in the abdomen area, in the lower abdomen area, in your thighs and in your buttocks. Okay, and this fat has a capability of producing estrogen. Okay, estrogen is of two types, E1 and E2. It produces E1 type, which causes estrogen predominance. So fat is the main culprit behind this. Trans fat is a main culprit. Liver dysfunction, what is this? Has to do with the estrogen. Liver metabolizes this estrogen. Any problem in the liver can cause metabolic disorders in metabolizing the estrogen, leading into estrogen predominance, which is a very rare kind of thing. Lack of ovulation, if there is no ovum production, there is no ovulation at all, that can also cause increased estrogen. Or maintained level of estrogen with low progesterone. Okay, and then we have medication. This is very important. Here we have to stress about stress, that is we have to have a deeper look into stress, gut dysbiosis, excess body fat, medication. These are the four main reasons why people are suffering from fibroids in this age or in an early age. Okay, what does medication have to do? People who have started their oral contraceptives at a very young age, that is in their teenage or in their early 20s, can have fibroids. And also not only that, if you are using hormonal pills for your PCOD, that can also trigger fibroids in certain section of people. So if you are someone who is using oral contraceptives, without any doctor consultation, or if you are using hormonal medications, you have to be very cautious. Diet, what has diet to do with high estrogen level is that the consumption of meat, red meat, which includes mutton, lamb, pork and beef, if you are eating any forms of these kind of meat, that can lead into hyperestrogenism. And if you're someone who is in plant-based diet, and if you're taking a lot of soy products which have phytoestrogens in them, that can also lead into fibroids. So if you are monitoring your diet with which has less number of estrogen producing contents, that can decrease the chances of you having fibroids. Since we have already discussed that there is estrogen predominance, this is estrogen, either decrease in progesterone or increase in estrogen can cause estrogen predominance. And estrogen predominance, how does this create this fibroids? Remember that if you take this as the female reproductive system, this is the uterus, there is an underlying tissue inside it called as the endometrial tissue, right? So what does this estrogen do? Estrogen has a certain capability to increase this endometrial tissue and to make it stronger, and also progesterone also has the same kind of thing. But the thing here is that not only endometrium, the whole uterus or the whole body is very estrogen susceptible. So when there is increased estrogen, what happens is that the uterus can start having these small blobs, that is tumors, non-cancerous tumors, which are fibroids. It can grow anywhere. So these are developed under estrogen excess, and when they get into a certain shape and size, they can start producing their own estrogen and growing on their own without any external estrogen help. Okay, so what does this progesterone do then? This progesterone will counteract the estrogen. It will help in counteracting the estrogen so that these fibroids will not grow. But in certain section of people, even progesterone can cause an increase in fibroids. That is why when you consult a gynecologist and they are giving hormonal pills, it does not work for certain section of people, while it works for certain section of people. So estrogen will cause this fibroid tissue to develop, and this fibroid tissue will have certain susceptibility, that is certain attraction towards this estrogen. Even if there is very low amount of this estrogen also, they will be very susceptible, then they will start to grow. This is the basic thing that is happening in the body under estrogen dominance. Apart from the, what are the other symptoms of estrogen dominance? First one is irregular cycles. It can be PCOD, it can be fibroids, it can be endometriosis, it can be adenomyosis. All of these are caused by estrogen predominance. Heavy periods or no periods, which is a characteristic of fibroid, which is heavy period, and no period in PCOD. Hormonal headaches, you might be having or experiencing bloating, anxiety, mood swings, which is very common in estrogen dominance or estrogen predominance, where you will be feeling very lethargic throughout the day. You will feel sleepy throughout the day, and at night you will not feel sleepy at all. There will be sleep disorders as well. And also you will be bloated. You will feel like even if you are eating a very small quantity of it can be rice or carbohydrates as such, you feel like you have put on a lot of weight, especially in the belly area, and you're feeling very, you feel that you've accumulated a lot of water, and also there is a lot of gas inside your digestive system. All of these are also symptoms of estrogen dominance. Apart from that, there is breast tenderness, and even though you're controlling your diet, there is resistance to weight loss. That is, body is tends to get weight gain, or it tends to become a little bit fluffier, but it tends to stop the weight loss program in the body even after diet or even after your exercise or your workouts. So there are certain dietary restrictions you need to maintain if you are under estrogen dominance. If you're someone who's suffering from hormonal disruption, or if you're suffering from fibroids, adenomyosis, endometriosis, or ovarian cyst, chocolate cyst, or PCOD, and you're looking for cure, Fidicus Homeopathy is the answer. Here we have two types of consultation. One is online consultation and offline consultation. In the online consultation, we are having audio option and as well as video option. If you're someone who's staying nearby us, you can come and contact us in person. If you're someone who's staying far away from the nearest branch of Fidicus, you can contact us through online consultation. After the online consultation, we will be asking you for certain investigations regarding your symptoms, and if you have any sort of investigations already priorly done, you can share it with us. After the doctor consultation, especially to the online clients, our medication will be reaching your doorstep through courier. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. Across the globe, it can take 4 to 8 business days for our medicine to reach your doorstep. If you want to have a consultation, please do call us on this number, WhatsApp us, or message us through this number. If you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone suffering from fibroids, if you're seeing our video, remember that this video is done because of the lot of patient success rate that we're having, because we're doing this video for their queries itself. Many people are calling us just for for a lot of questions they have on fibroids, and then they're taking the appointments and then they're getting cured. So there is good success rate. So that is why if you're someone who's suffering from all of these diseases, especially female reproductive organ diseases, you have to choose Fidicus Homeopathy. Why should you choose Fidicus Homeopathy out of all the homeopathic doctors in the world? See, Fidicus Homeopathy stands for highest chance of health. Here we have three things. One is highest success rate, already curing things that are we are discussing here. Second is a transparent medication. There is no gray area between the patient and the doctor. Here we will be educating you on your prognosis. And the third thing, the personal care. The queries that you're doing or the queries that you're presenting, we are taking care of it and we are answering this through our videos, so that majority of the people who are not able to reach us out are seeing this video and they are getting answers for their questions. So the personal care at Fidicus Homeopathy is top notch. If you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.